ARFID is a eating disorder where people develop a restriction to food intake, and that could be reduced in either their quantity or the quality or the variety of the food that they eat. And it causes a major disturbance in either their physical health, their nutritional needs, or their psychosocial functioning.
How does it manifest differently to other, I guess, more well-known eating disorders?
So when people develop ARFID, the main driver for the restriction isn't related to body image, and it's not related to the concerns about their weight or shape. So the drivers for the restriction are very different. So they can be related to sensory issues, they can be related to a fear of eating due to an aversive consequence of something negative that's happened, or they could be due to a lack of interest in food. So that's the main difference. Where other eating disorders, the reasons for restriction are to either change or control somebody's body shape or weight.
ARFID was only recognised formally in 2013, but is it likely that this disorder has been affecting people for many years and has just sort of been undiagnosed or misdiagnosed or almost wrapped up in other diagnoses?
Definitely. So prior to the recent description in the most recent diagnostic manual, there was an understanding that young children would have restrictive eating, and there was a diagnosis that related to that. But it was very misunderstood. So typically it can be misunderstood as just fussy eating, as a normal developmental phase that children will grow out of. And it can also be misunderstood as anorexia or another type of eating disorder.
So how common is it, and what are some of the treatments available?
So it's very common, and as more information gets put out, it's becoming more diagnosed and more prevalent in eating disorder settings. And the treatments available range depending on the age of the individual. There's family-based treatments available, and there's more individual treatments that are based in cognitive behaviour therapy. But the treatment basically as young people and adults are experiencing ARFID develop a bigger range of food and start to become more exposed to different foods gradually over time. So starting with foods that they currently feel safe with, that will then address the nutritional deficits they're experiencing, and then gradually expand into other foods as they feel more comfortable and develop some anxiety management techniques.
Yeah, you sort of touched on it there with this underlying anxiety. ARFID is often experienced in tandem with other disorders, right? What are some of those other sort of common co-diagnoses?
Yeah, so it's very commonly experienced with other types of anxiety disorders, so obsessive compulsive disorder, as well as like separation anxiety disorder. And typically we see a lot of people with neurodiversity actually that might develop ARFID, and there can be a lot of kind of sensory needs that young people and adults have that are kind of comorbid. So a lot of anxiety and neurodiversity is very highly correlated with ARFID.
Clinical psychologist Ainsley Hudgson there. Thank you so much for your time.
Thank you for having me.